Welcome to a presentation on diabetic vitreous hemorrhage brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Diabetic vitreous hemorrhage can be thought of like a plumbing problem. The vitreous is like a pipe that carries fluid throughout the eye. When diabetes affects the blood vessels in the eye, it can cause them to become weak and leaky, just like a pipe with a crack in it. This leakage of blood into the vitreous causes it to become cloudy and filled with blood, just like a pipe that is clogged with debris. As a result, vision becomes impaired and can even lead to blindness if left untreated. Diabetic vitreous hemorrhage is a condition in which blood vessels in the eye become weak and leak blood into the vitreous humor, the gel-like substance that fills the back of the eye. Symptoms of this condition include blurred vision, floaters, flashes of light, and a decrease in vision. Blurred vision occurs when the blood in the vitreous humor blocks light from entering the eye. Floaters are small spots or lines that appear to move across your field of vision. Flashes of light occur when cells in the retina are stimulated by a sudden change in pressure within the eye. Lastly, a decrease in vision can occur if there is a large amount of bleeding within the eye. Diabetic vitreous hemorrhage is a condition that affects people with diabetes, particularly those who have had diabetes for a long period of time. It is more common in people over the age of 50, and it is more likely to occur in men than women. People with poor control of their blood sugar levels are also at an increased risk for this condition. Additionally, African Americans and Hispanics are more likely to experience diabetic vitreous hemorrhage than other ethnicities. Diabetic vitreous hemorrhage is caused by high blood sugar levels in people with diabetes. When the blood sugar levels are too high, it can cause damage to the tiny blood vessels in the eye, leading to bleeding in the vitreous humor. This can cause vision loss and other complications. High blood pressure can also contribute to this condition, as it increases the risk of damage to these delicate vessels. Treatment for diabetic vitreous hemorrhage typically involves laser surgery or vitrectomy. Laser surgery is a procedure that uses a laser to seal off the leaking blood vessels in the eye. This helps to reduce the amount of bleeding and can help improve vision. Vitrectomy is a more invasive procedure that involves removing the vitreous gel from the eye and replacing it with a saline solution. This helps to reduce pressure in the eye and can help improve vision. In some cases, medications may be prescribed to help reduce inflammation and control blood sugar levels. The prognosis of diabetic vitreous hemorrhage depends on the severity of the condition and how quickly it is treated. In most cases, the hemorrhage will resolve itself within a few weeks or months with proper treatment. However, if the hemorrhage is severe, or if it is not treated promptly, it can lead to vision loss or even blindness. It is important to seek medical attention as soon as possible to ensure that the condition does not worsen and that your vision can be preserved. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.